Right. I think we have a good mass of people, so we have a lot to cover today. So we'll go ahead and get started. Um, I just will take a minute to introduce myself. I'm Jeni Sorensen. I'm the director of the Human Trafficking Research Initiative. I'm here with my colleague Alina Bitran, who's the associate director of HTRI. And we're excited to share some insights today about what we've learned over the last 5 years working on the Human Trafficking Research Initiative. If you want to go to the next slide. Okay, so here's what we're going to cover today. We're going to do a really quick introduction to HTRI and IPA. I think we see a lot of familiar names here, but there may be some people who aren't as familiar, so we just want to give you a quick intro. We'll talk about our research and learning agenda, which is something that we've developed. It's kind of the foundational document for our initiative, so we want to give you a little bit of information about that. We'll go into stage-based learning frameworks, which is kind of how we envision at IPA the research to evidence use kind of continuum. And that again informs our work. And then finally, the meat of what we'll be covering today is the state of the evidence on what we've learned from the research that we have been funding and as well as the broader research in the field. This is a webinar format, so you're welcome to ask questions in the chat throughout. We have Valentina and Natalia, our other team members, who are here to be monitoring the chat. And you can ask questions throughout, and they will be either interrupting us, Alina and I, during the presentation to put your question in there at the proper time, or we can cover those at the end. So please feel free to, again, put in anything in the chat when you're ready for that. All right, so we'll go ahead and get started. If you want to go to the next slide. All right, introduction. So go to the next slide, please. All right, so again, a really quick intro, just one slide about IPA. If you're not familiar with us, Innovations for Poverty Action is an organization. We're best known for our work in impact evaluations, but we do a lot of work around these different things our mission is to improve the lives of people living in poverty. So we work to create stronger evidence of what works to reduce poverty. We share the evidence strategically with practitioners and policymakers, and then we try to equip decision makers to understand and use this evidence to improve the lives of the poor and help governments and then other implementers and funders to make the best use of data and evidence. Next slide. This is the HTRI team. So the Human Trafficking Research Initiative is part of IPA's sector programs team. Again, you see 4 of us, the 4 staff that are working on this program here. And then we have our academic leads, Guy Grossman, Cecilia Moe, who are not staff at IPA, but do a lot to help inform the trajectory and the decisions that we make on which research funding that we provide under the Human Trafficking Research Initiative. Next slide. Okay, and I've mentioned this initiative for a while. Again, if you aren't familiar with us, we started as a collaboration with the Department of State's Office to Monitor and Combat Trafficking in Persons, which is JTIP, and their program to end modern slavery, which is called PEMS. And this started as an acknowledgement that there was a lot of research that had been done on human trafficking over the past 20 or so years, and many, many programs to try to combat trafficking in persons, but there hadn't been a lot of rigorous quantitative experimental studies to look at, the actual effect and impact of the programs. So this was an attempt to kind of fill that gap. And to do that, HTRI fosters partnerships with researchers and practitioners. And then what we're mostly known for, what we've been doing a lot, we spend a lot of our time implementing a competitive research fund. And so that's where we're giving early stage funding for seed grants and exploratory work to try to see what kind of things can be tested with impact evaluation structures or quasi-experimental research. And then we also do fund partial and full funding for randomized control trials, impact evaluations, and quasi-experimental research. Next slide. This is where we have programs so far. I think we've funded 30, 31. We're in the process of funding more right now, so I'm not sure the exact number at today's date. But as you can see, we have kind of a wide range of geographical footprint. We've been implementing in every region in the world and learning a lot from this kind of geographic spread. Next slide. All right, and then I'm going to talk a little bit about our research and learning agenda. So you can go to the next slide. As I mentioned, this is where we have put out what our priority research questions are around the kind of 4P, 3P, 4P structure that the Department of State uses. This is our foundational document. This informs all of our work, and we have consulted many people. Some of the people in this virtual room were part of those early discussions and continued discussions. We've engaged survivors to look at the and provide input on the content and then the revisions, as well as our research documents that we use. And then we update this annually or sometimes even more often, depending on what research is coming out, because we want to make it current and make sure that it's reflecting the emerging needs of the field. Go to the next slide. So I think Valentina has put in the chat, if you want to see more information, we're not going to spend too much time on the RLA today, but there's a lot in there that we hope that you can dig into. These are the 5 priority questions. So again, you can see they follow the 3P, 4P structure: prevention, protection, prosecution, and partnership. And so this is how we'll be talking about kind of our lessons learned to date, what kind of research, again, we've funded and what we've learned. Go to the next slide. Okay, so I'm going to hand it over to Alina to share the stage-based learning framework with you.
Thank you, Jeni. Great. So before jumping into the actual evidence and what we've learned at HTRI, we first wanted to take a step back and talk about where exactly HTRI fits within the broader human trafficking research ecosystem. So to do this, we like to refer to IPA's research stage-based learning framework. This is a framework developed by the RFE team within IPA. If we could go to the next slide. So the scale-based learning framework says that interventions are at different stages of maturity along a path to scale, and that we should consequently be adapting the key research and learning questions based on where these interventions are on their path to maturity. So the framework lays out 5 different stages in this path. The first stage is the ideate stage. This is the very early stage where we're thinking about the root causes of the problem, needs of beneficiaries, and potential interventions that could address these problems. Next, we move on to the refinement stage. So once we have an understanding of problems, of root causes, we start thinking about potential interventions that could address these problems and thinking about whether these interventions might be feasible, acceptable, and adequate for the problem identified. Following this refinement stage, and once we have more information, we move over to the proof stage. This is where we're actually testing for impact on final outcomes and also thinking about cost effectiveness. So this is where that rigorous evidence is being developed. Following the proof stage, we move on to adaptation. So once we do have that rigorous evidence about whether or not a program works, we're interested in learning whether a program might apply in a new context, whether those needs are the same, whether any elements of those initial program need to change, and whether kind of these key outcomes are still being achieved in new contexts and with potentially new beneficiaries. And finally, following this adaptation stage, we can start thinking about scaling, which is questions around what the optimal scale for the program is and how we can reach more beneficiaries while maintaining fidelity to the core components. So again, 5 different stages in this path to scale, and we can see how the questions are adapting based on where the program is. Could go to the next slide. So given the difference in the research questions among this path to scale, we also need to be thinking about the different methods that can most appropriately be responding to the question. So in this slide, we lay out the methods that are recommended for each stage. And I won't go through all of these, but we can basically see how starting from the ideation phase, we're going to be interested in needs assessment, evidence reviews, intervention development research, more of this earlier exploratory research to identify the problems. Whereas as we move over to refinement, prove, adapt, we're potentially going to be doing more evaluation, piloting, A/B testing, monitoring. And then finally, at the scaling stage, we're going to be more interested in scaling and implementation research. And again, we want to include this slide because we want to be talking about where HTRI fits specifically within this stage. If we go to the next slide, we can see that HTRI is going to be more specifically interested in refining, proving, and adapting. Especially during the proof stage, we're interested in impact evaluations, so quasi-experimental studies, randomized controlled trials that can generate this rigorous evidence. So again, we lay this out because During the next slides, we're going to be talking mostly about evidence from impact evaluations, RCTs, quasi-experimental studies. This is not to say that all of the other great research that is being done in the human trafficking space is not important. On the contrary, we need all of this research in order to be able to move along the path to scale. But we are going to be focusing on the proof and adapting and refinement stages specifically. So there's a lot of great research that we are not going to be including in this presentation, but that hopefully one day we will be able to test and evaluate through these HTRI mechanisms. So with this, I'll turn it back to Jeni and we can start going through some of this evidence.
Thanks, Alina. And just a quick note too, as Alina mentioned, we're not going to go over all of the research that's happened, but if there is something that you believe is missing, we're always really excited to hear about new research we might have missed. We try to do our best to capture it all, but we may not get it all. So please do send us any additional studies that you know of or that you're working on. All right, so we'll start now. Next slide. On prevention. So if you go to the next slide, you'll see that this is the area that is most well-funded, with implementing organizations doing a lot in this area. And as a result, probably related, most of the research that's been done to date also is in the prevention space. So this will be the longest part of the presentation, and we'll be actually digging into this with kind of 4 different buckets. We've broken it up into programs to identify and support at-risk populations, private sector focused interventions, information and awareness raising programs, and migration policies and practices. So we go to the next slide. So you'll see we have this kind of summary slide for each of the Ps that we cover, and just to walk you through it, as you can see, we're looking at high effectiveness and mixed or low effectiveness on the vertical, and then the horizontal, we're looking at less evidence to more evidence. So what you see in the dark green at the top right would be interventions that we believe are the most promising and that have kind of evidence-based or they're proven interventions, where you would see the pink is where we're seeing studies that are showing us that there's less effectiveness or no effectiveness. Things that are promising are going to be in the light green, where we see there's potential to do more studies on them because those could be highly effective. And then with yellow, we are seeing not that many studies, and it's not really looking that good for effectiveness. Also throughout the presentation, you'll see that we have some things that are in gray. Those are more early stage exploratory studies. So we're saying, again, we think that this is promising, but there aren't impact evaluations that can back that up yet. So we want to, be cautionary about that. And then the bolded interventions are the ones where there's at least one impact evaluation or quasi-experimental, research that will that is contributing to the evidence base on those specific kinds of interventions. All right. So you can see here again, we'll go through these in the next slide. So I'll save it for the next slide. So please go to the next one. Okay, so we'll start off with programs to identify and support at-risk groups. So where we're seeing the most promising interventions are around community-empowered social protection programs. So that's where there's community organizing. There's a focus on access to legal rights and government services. We're seeing that these can reduce embeddedness and increase food security. Fair recruitment programs are also looking like they can reduce recruitment fees and improve understanding for workers about their rights and their pay. But we haven't seen that these have increased actually job satisfaction or trust in employers. School-based assertiveness counseling, and then economic strengthening paired with education and family coaching. Those are also things that are being shown to be or look effective, and especially with the economic strengthening and then family coaching has been shown with child labor to be especially effective. Where we're seeing less effectiveness or no effectiveness is with cash transfers. Cash transfers on their own are known to be a really effective mechanism for reducing poverty and for improving people's lives generally. But for child labor interventions, they're not really, there's a lot of mixed evidence on that, or there's shown that sometimes cash transfers can improve household welfare, but then some children are actually being pushed into work because parents are leaving the house to go and work. So there's kind of mixed effectiveness of that, and then there's not really enough out there that's showing the impact of cash transfers specifically on human trafficking. So we would want to see more evidence, more research focusing on that. If you go to the next slide. For private sector focused interventions, this is where we need more information. There's some potentially promising work that's being done on free legal services that's helping to improve awareness of labor violations and access to resources, but there are some logistical and access barriers that would need to be identified and addressed. A lot of what's been happening here is seen to be less effective or not effective. These include financial incentives for low-tier contractors. So IPA funded a study in India with micro loans to micro contractors, and there was no impact on labor practices in that case. And then with productivity enhancing interventions, we also helped to fund part of a study in Bangladesh looking at brick kilns and whether environmental practices with more effective kind of technologies that would help to reduce indoor health impacts for kiln workers. Again, the productivity kind of interventions worked, but they didn't really have an impact on labor practices in that case. And then worker voice and feedback platforms. Again, this is where we see that there's a lot of focus and funding going towards that, but there haven't really been any impact evaluations or not many that are rigorous that we can point to yet. So we'd like to see more research happening on that. Next slide. For information and awareness raising, this is where we do have a lot of data to show what is working and what is not working. For promising interventions, really targeted information delivery is one of the key things where if you're working with the right populations at the right time and using the right kind of mechanisms to reach people, then that has been shown to be effective. Peer-to-peer and community messaging has also been shown to be one of the more effective intervention kind of modalities to use, and then training for healthcare and social service providers. Where we see less effectiveness and where we think that people should start to shift away from pre-departure trainings for migrants, just doing those alone as one-off trainings are not shown to have had an impact on people's outcomes when they've migrated. Generic information campaigns are another one where just telling people that they shouldn't, what trafficking is, or that they shouldn't be migrating, or that trafficking is bad is not really helping. And then school-based awareness is another one where HTRI has funded some programs there, but the variation in the implementation of school-based awareness campaigns and then just the outcomes from that have not been shown to be as effective as we had hoped. Next slide. Finally, with prevention, the migration policies and practices, what we've seen that are effective practices are fair recruitment and ethical migration campaigns. And then what we hope to see more information on is digital platforms and social media safe migration tools. Those have some early promising results, but haven't been tested in full impact evaluation. So we need more of that. Where we again have seen less results, either no effectiveness or mixed effectiveness is migration information campaigns. Trying to expand legal migration channels is a good idea, but it doesn't always result in actually better outcomes for migrants. Okay, so to conclude this one, so just to give you a couple of quick examples of things that we funded in this area, the targeted information delivery, we funded a study in Greece that used web-based, so like a website, static information, and then WhatsApp-based, so dynamic information provision from paralegals to provide information to to migrants and people, asylum seekers and refugees in Greece. And this showed that both kind of platforms had an impact, but at different times for different groups, and that the WhatsApp intervention was especially effective. And so we're happy to share that out. We have some of the early findings of that on our website. What's interesting about this also is that it's kind of a combination of both. People could access the information on the website at any time, but when they needed targeted, really intensive information, they were able to rely on the WhatsApp. But that also is, of course, using people, paralegals, and it's more expensive. So it's good to have a mix of both things with different price points if you're looking at developing interventions. And then with the migration information campaigns, we helped to support the inline cost for a program in Nigeria. And this showed that there was an impact on the awareness of potential migrants traveling in the migration corridor from Nigeria up to Europe. The Mediterranean route was called. but the actual impact on migration behavior was limited because if there were not economic alternatives that were available in the home states that were studied, then people were still going to migrate. So they understood the risks, but they didn't feel like they had a choice. All right, next slide. All right, so just to wrap things up for this one, here's some of the things that we've seen, just kind of overall themes that shape effectiveness for prevention projects. So as I mentioned earlier, the relevance and the timing are essential. So you need to reach people when they're about to migrate, when they need this information, and it can't be too abstract or too general. We really need to be thinking about which populations need information when, and then how do we deliver that information. So that's the format part, whether people get their information through radio, through TV, through interactive one-on-one support, through support groups. There's a lot that rides on how you're reaching people and again, when you're reaching them and what kind of information you're providing. And then finally, no matter how much information you provide, if there are structural barriers that prevent people from accessing their rights or getting the right information, then awareness alone is not going to really work. We have to look at structural changes and legal changes instead. All right. So that's it for prevention. I'll move us on to protection, unless there are any questions. I guess Valentina or Natalia, you can interrupt me if you want to talk before then. All right, so protection, if you go to the next slide. So for protection interventions, you might know that the way that the Department of State defines this is identifying, assisting, and supporting individuals who have been trafficked. So we're looking at support for people who have experienced trafficking, and then also looking at recovery of those people and also trying to prevent re-trafficking and looking at the core causes that led them to be vulnerable in the first place and trying to address those. So the two buckets for that we looked at are trauma and survivor informed programs and then survivor support and reintegration programs. If you go to the next slide. All right, so here's our summary of least effective, least studied to most effective, most studied. In the most effective bucket, we do have trauma-informed psychotherapy, training for healthcare and social service providers, economic empowerment interventions, and then psychological interventions to address stigma. We have less information about the evidence of some of the things, and then we also would like to look more at CBT, cognitive behavioral therapy, developed by non-specialists, and then mind-body interventions. And unfortunately, we don't have very much information yet about survivor-led peer support interventions. If we go to the next slide, I'll dig into each of these a little bit more. So with trauma and survivor-informed programs, trauma-focused psychotherapy, there's specific modalities that have been shown to be most effective: narrative exposure therapy, CBT, trauma-focused CBT, and then interpersonal group psychotherapy. So these have all been shown to reduce depression and trauma primarily of child trafficking survivors and former child soldiers. Another thing that's been promising is training for healthcare and social service providers. There's been a big focus on that in the US, and then it's increasingly happening in other contexts. So increased awareness, identification, and referral capacity for those frontline workers has been really important to detect trafficking and then to help reduce stigma. And then mind-body interventions, there's preliminary promise in that. I'll talk about that a little bit more in a slide coming up. Where we've seen mixed results are with EMDR. I have to always remember what this is: eye movement desensitization and reprocessing. So that's has been shown to be really effective for especially in high-income country contexts with depression and PTSD and other things. But for whatever reason, there's not that much that's shown that it's been effective among child trafficking survivors. We haven't yet looked at the impact on adult trafficking survivors. Next slide. And then with survivor support and reintegration. So we've seen that economic empowerment interventions, more widely, especially at IPA, does a lot of research and focus on economic empowerment interventions with our graduation approach. So we see that this helps to improve livelihoods and expand savings and has a lot of positive impacts, but there aren't many studies yet for trafficking survivors specifically. So that's an area of need and one where we hope to dig into more. Psychological interventions addressing internalized stigma. So these help to reduce stigma, improve self-image and savings. And then CBT delivered by non-specialists, we put this in the promising interventions. There's not much in the way of rigorous evidence or rigorous research on this yet, but we see the need for parasocial workers and other interventions provided by non-specialists because of the lack of certified, psychotherapists and social workers and other professionalized services like that in low and middle income country context. And so we see that this could be a potentially really effective intervention, but we need more interventions and more studies on that. And then where we've seen mixed results or null results are reintegration packages for former child soldiers. So those unfortunately haven't had the impacts that people had hoped they would. And then with survivor-led peer support, we have a program that we funded, I'll talk about in the next slide a little bit, that looked at this and showed some gaps in the actual structure of the broader care continuum. If we go to the next slide. Okay, so like I was talking about with the lower one, we helped to fund an exploratory work in Brazil where researchers were looking at a program that would be led by survivor counselors or survivor peer-led survivor support. But what they found were that there are just larger systematic challenges in the ability of the states to provide the actual referrals and support for survivors. And so just there needs to be some basic needs and housing, healthcare, other things that need to be in place before we can see impacts and actually have programs that can fully engage survivors as peer leaders and peer support in those situations. Another one that we funded was looking at mind-body interventions. We provided funding for an exploratory program in the Philippines. And this was kind of a yoga, mind-body based intervention. It showed some early promise, but it was not a full RCT. We are funding an RCT that is looking at the same intervention, but in Uganda. And we hope to be able to share out some findings from that soon. So we'll have more in that area. Okay, and so to wrap this one up for protection, as we mentioned, it's important to stabilize survivors before introducing mental health care. So it can be done continuous at the same time, but really there's the continuum of needs, and survivors really have to have feel safety and security and have basic care taken care of before you can start to focus on mental health. Building early trust through peer relationships. So again, survivor-led support we think is promising and can really help new survivors to navigate the challenges that they're facing in their recovery and reintegration journey. Providing structure, not only choice. So having flexible case management without guidance. We've seen a couple of programs that have shown that when there's a lot of questions and a lot of flexibility, when people are grappling with some of like the basic care, it can be more overwhelming and cannot improve well-being. So it's important to provide options, but also to recognize where people are in that journey and what their needs are, and give them the guidance that they need at that time. And then finally, investing in outcome measurement. We're seeing some challenges and gaps in validated tools, survey tools, especially in this area for low and middle income country contexts. And so we see that we need more investment in those to be able to adequately say that there is progress happening in these kinds of studies. Okay, next slide. All right, I'm going to hand it over to Alina to go over the next two Ps.
Thank you, Jeni. So now we'll go over the next two pieces Jeni was saying, prosecution and partnership. So starting with prosecution. Prosecution interventions are interventions that focus on strengthening the capacity of criminal justice systems. So here we're thinking about the entire criminal justice system pipeline, so from investigations, prosecutions, and deterrence of trafficking-related crimes. And we're also particularly interested in improving survivor outcomes. So here we have three main buckets of interventions that we're looking at in our research and learning agenda. First, interventions to support law enforcement and justice system to enforce laws against trafficking. Next, investigation and legal support for victims of trafficking. And third, community trust building and victim-centered responses. So I will go through each of these and say where the evidence is for each of these buckets. So in terms of the summary, as you will see here, we have lots of programs that are potentially promising, but for which there aren't yet many rigorous evaluations. This is the top left light green box. And these are actually many programs that we're drawing on from adjacent fields, so from other criminal justice system, public security fields, but that might not yet be rigorously tested in the human trafficking space. So overall, there's a lot of potential in the space, and this is one that we're particularly interested in investing in as HTRI. And I'll go through each of these in the next slide. So for this first category of supporting law enforcement and justice system actors to enforce laws against trafficking, we have three potentially promising interventions. The first one is one for which there have already been some randomized controlled trials. This is law enforcement trainings. Law enforcement trainings appeared to be promising in some contexts. So for example, in Nepal, there was a randomized controlled trial that was actually co-led by one of our scientific advisors, Cecilia Moe. This study worked with 1,000 police officers in Nepal and found that these police trainings increased knowledge of penalties and recognition of victims, but it also had the mixed effects of actually increasing victim blaming. So this is something that we're interested in studying more and seeing how some of these other side consequences can potentially be avoided. And there is also some evidence in the US. Some specialized trainings have improved awareness, identification, and investigation likelihood. So again, this is one where there is promising initial evidence, but where we definitely want to test more to see all of the results. And then the other two, there haven't been very rigorous studies yet, but are promising. One is behavioral interventions for offenders. So we've already talked in past slides about cognitive behavioral therapy, but this is one area that has shown promise in adjacent fields and that we would be interested in testing in the human trafficking space specifically. And then we're also interested in technology-enabled enforcement, which could include AI, digital forensics. These are very promising in other fields, especially AI, but they have remained largely untested in this field. So something that we also want to prioritize and that we currently are, as you will see in one of the later slides. Could go to the next one. So the next one, investigation and legal support for victims of trafficking. Here you will see that everything is grayed out, which again means that there aren't yet any rigorous impact evaluations, but some exploratory studies. So in terms of promising interventions, there's some exploratory work that has been looking at multi-agency task forces with specialization in human trafficking, specifically protocols and dedicated personnel to investigate more cases, make more arrests, and achieve higher charging rates. This has appeared to be promising in some of this more qualitative work and something that we're interested in exploring. And I'm going to jump to the other side of mixed results where you'll see task forces without trafficking expertise. Also some exploratory work that is showing that it's not enough to just have a task force in itself, but what's actually going to make the difference is that these task forces are actually specialized and have specific human trafficking knowledge. So it's not just about the coordination, but about the trafficking specific capacity, which is something that we want to look at further. And then jumping back to promising interventions, we're also interested in learning more about alternatives to poor victim testimony. So there's currently, as you may know, an over-reliance on victim testimony, which really makes some of these investigations very complicated. We're interested in exploring some other possibilities to these, which could include digital evidence strategies, video interviewing, plea agreements, and expert witnesses, and hoping that these might help reduce this reliance on survivor testimony and strengthen cases. But again, no rigorous evidence yet to this effect. And then third, we're also interested in evaluations or interventions with victim support and service coordination. Exploratory work shows that these may improve trust, coordination, cooperation, and case follow-through, and may help mitigate intimidation and credibility barriers, which are very important to being able to conduct some of these investigations effectively. Next slide, please. And then in the community trust building and victim-centered responses, we first have procedural justice policing. This is a very well-tested intervention. That's kind of the gold standard in some of the other fields. It includes respectful communication, neutrality, dignity, citizen voice. This has been shown to improve police legitimacy, compliance, and willingness to cooperate. What we don't yet know is whether this also applies to the human trafficking space and whether this could help improve human trafficking reporting specifically. So something that we would be interested in testing and adapting. And then another promising intervention here includes victim-centered approaches and alternative justice. We know that survivors often prioritize restitution, documentation, housing, to what Jeni was speaking to earlier about some of these early immediate needs. These are often the priority above traditional prosecution. So we're interested in looking at some of these models, for example, a compensation scheme that have shown exploratory promise, but that have not yet been rigorously evaluated. Next slide. Great. So as we were saying, and as you saw in the last slides, there isn't too much rigorous research yet on prosecution. This is why, as some of you may know, during our last call for proposals, HTRI specifically prioritized prosecution projects. So the call was only open for prosecution projects, and we received some great proposals of projects that we're just starting to fund now. So the two examples that we have here are projects that have just started, so results are still pending, but we still want to tell you a little bit about which of these areas HTRI is currently working on. So the first project is one in Nepal. This is a community-based legal assistance to improve justice for migrant victims of fraud. This is an evaluation where we want to test whether community-based legal assistance for migrant fraud victims in Eastern Nepal can actually help improve case filing rates and compensation outcomes and ultimately survivor well-being. So this project just began 1 month ago, but we're very excited to see if this can help contribute to this evidence base, this promising evidence base around both legal services and victim support and service coordination. And then the second project is in Brazil. This is also a full randomized control trial. It's evaluating the impact of an AI tool to process labor trafficking cases in Brazil. So this team of researchers has developed an AI decision tool for labor trafficking prosecution. This tool is using an adapted risk model to help identify high potential cases and see if this can actually help increase the number of cases advancing to formal investigation as a first outcome, and second, the total value of civil penalties. So again, this project also just began 1 month ago, but we are very interested in seeing the potential of this study and potentially learning more about predictive analytics and AI and potentially being able to replicate to some of the other contexts. Finally, again, some high-level lessons learned on conditions that shape effectiveness, as we've been talking about in some of the other slides. It's not only about the what, specific intervention, but it's really about the how. So how the intervention is implemented and some of these factors that are going to contribute or deter its success. So the first one we found is that trust is essential. Respectful, trauma-well interactions and supportive community environments are really what's going to shape whether survivors report, cooperate, and stay engaged. There's a lot of stigma, stimulation, and cultural norms around human trafficking, and this is currently blocking this detection and undermining outcomes, even when system capacity exists. So again, addressing trust through some of the interventions that we've been presenting, like this procedural justice or some of these other community-based interventions, are hoping to build out the trust that can eventually, hopefully, lead to improved capacity and cooperation. Second, frontline specialization drives outcomes. So again, we saw that it's not just about having effective law enforcement or about having the trafficking units. We really need the specialization and specific knowledge in trafficking and applied training. It's not just about the general awareness, but about actually being able to adapt some of these interventions with the specific human trafficking specialization. And then finally, technical tools work only within prepared systems. We are currently in the AI era, and what we need to do here is make sure not just taking AI and applying it blindly, but actually making sure that it's being applied to a system that is ready, that is prepared to take on this capacity. So AI, online exploitation enforcement, forensic innovation require strong and robust legal frameworks, data governance, and trained investigators to actually be able to deliver true impact. Great, so that is what we had for prosecution, and now we're going to move on to the last section, which is a pretty quick one on partnership. So partnership is more of a cross-cutting section. It actually touches all of the other pieces that we've been talking about. It includes multi-sector partnerships, particularly those involving technology providers, private sector, civil society, and governments. It's a very promising but underexplored area in counter-trafficking research. And for HTRI specifically in our research and learning agenda, we look at two main categories. The first is private sector partnerships, and then second, technology interventions. So again, this is still a pretty understudied area. We have some interventions that we believe could have high effectiveness, but for which there is not a lot of evidence. We have some for where we have more evidence in this green one, and then some with mixed low effectiveness and less evidence. And I'll go through some of these, but overall here you can see that these are kind of less than in some of the other categories that we've presented. So again, an area that we want to invest in more. Could go to the next slide. So starting with private sector partnerships, in terms of promising interventions, we have seen rigorous work on transparency and public disclosure. So there is, for example, one quasi-experimental study in Jordan that showed that publishing factoring compliance assessments due to a new program that actually made this mandatory increased the transparency and adherence to labor standards, which was a great initial sign. However, there are some other studies that show that this in itself is not enough. Some of the lowering performing factories may need additional support beyond just disclosure in these transparency measures. So again, promising, but needing of some more study and evaluation. And then mixed results, we see auditing approaches. So these auditing approaches still remain limiting in detecting forced labors due to many factors, among them potentially weak interviewer training, lack of worker interviews, and a focus on tier one suppliers. So these are still potentially missing some of the risks deeper in supply chains. And then second, we also see certification and multi-actor supply chain initiatives. So these are sector certification programs, cocoa, palm oil. We've even starting to see them in the hospitality industry. And buyer supply partnerships are showing mixed effect. There are still no rigorous studies with robust evidence that show that these actually reduce trafficking risk in supply chains. And then next slide. And finally, to end with technology interventions. In terms of promising interventions, the first one that we have here is more of a methods one, but we still wanted to include it because there are some rigorous studies showing that social media and phone-based surveys are very effective in reaching at-risk populations. This is actually research that's coming directly from IPA that's showing that WhatsApp or social media surveys can show higher response rates and lower selection bias, particularly for highly mobile or difficult to reach populations. So again, a methods finding for the human trafficking space where it's very difficult to reach some of these populations. This is a promising area of methods. Other promising interventions include predictive analytics and AI. So again, we've talked about machine learning tools, data linkage, and dark web analysis, show promise in adjacent fields, but still like rigorous evaluation for trafficking enforcement of prosecution. We're hoping that the Brazil study that we talked about in the past slides can help contribute to this space. And then finally, some other tech innovation models, such as hackathons. There are some promising tools developed, but still no evidence of sustained usage, adoption, or impact. And then finally, mixed results. We have migrant worker apps. Jeni already talked about this. Again, partnership is more of a cross-cutting field, but some of these apps we found have provided employer recruitment information can support safer job matching. However, they are rarely reaching early recruitment vulnerabilities and have not yet been testing for outcomes. Next slide. So finally, 3 high-level takeaways for partnership. The first one, which we've been repeating over and over again, but just to emphasize one more time, trust and credible delivery matter. Interventions work when they reflect real risks and local context and are delivered by trusted local actors rather than anonymous platforms. It's not enough to have a good intervention in itself. Again, the implementation is going to be critical for what the outcomes are ultimately going to be. Second, design and operations must work together, thinking about simple, low bandwidth tools with flexible features that are going to sustain engagement, and when they're supported by the broader operation, so clear roles, ethical safeguards, and strong referral pathways. Weaker infrastructure, on the other hand, can always increase vulnerability. And then third, monitoring implementation and not just outcomes. So for many of these tools, it's important not just to be looking at the final outcomes, but actually tracking delivery, quality, user experience, program fidelity. So thinking about stage-based learning, doing some of that earlier research in terms of refinement, process evaluation, making sure that these programs are actually being delivered as intended is going to be very important. Implementation challenges, as we've discussed, are often explaining success or failure just as much as research design itself. Could go to the next slide. So that was all in terms of the evidence that we've seen for the 4 piece. We wanted to now point you to resources and further reading. So we have some documents here that we will share. Valentina already shared the link to our research and learning agenda. We've also published some evidence briefs on prevention, protection that you can find on our website. We also have the newly published Evidence for Impact Insights from the Human Trafficking Research Initiative, where we talk in a bit more depth about some of these projects and what we found, especially focused on some of these implementation challenges and enabling factors. And then finally, we refer you to the HTRI-funded project page, where you can see some more of the projects that we funded. We also wanted to give you a heads up that we're finalizing HTRI's evidence wrap up, and we're hoping to publish now in early 2026, which discusses more of the evidence that we've talked about today. Finally, we wanted to say that we are excited to partner with all of you. We are hoping to launch another call for proposals for full impact evaluation, hopefully in around 2 months. So please stay tuned to that. We're always excited to keep developing the human trafficking evidence base, and we're hoping to be able to fund some more projects that can contribute to that. So if you haven't already, please sign up to HTRI's mail list. We can also link this in the chat now so that we can send you all of the information and stay in touch. Great, so we have a few minutes remaining. We would love to see if there are any thoughts, questions, ideas. We would also love to hear from all of you. And thank you so much for your attention and for bearing with us. We know it was a lot of information, so thank you for being here. Feel free to put those questions in the chat or raise your hands and we can address those. Well, I'm not seeing any questions in the chat. So here is the IPA HTRI email address. Please feel free to reach out to us if you do have any other questions later down the road, if there's anything specific that you'd want to talk about, if you want to learn more about the funding rounds, we're always very happy to be in touch and jump on calls to talk about any of this.
Right. I guess we were super clear, so that's a good sign. But yeah, as Alina mentioned, please feel free to write to us. And especially if you've seen any studies that should be in there, please let us know. Oh, there is one question. Do we think we'll continue to use the 4P framework? Do we have any plans to evaluate that model? We haven't discussed that with the Department of State, but we're happy to bring that up. I know there's been some other groups and countries and organizations that have moved away from that. But we are funded by the US Department of State, which still uses mostly the 3P framework. So we'll probably be using that unless they change that. All right. Well, thank you again for joining, and we will, like we said, post this on the website. So thanks again, and have a great day.